Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I'm so pleased to welcome Dr. Jose Alvarado. You are a pediatrician here locally with the group Jose F. Alvarado and Associates.
Yes, thank you.
So happy you could join us today.
Thank you very much for having me. I'm excited to talk about this topic with you.
It's a very important topic and very relevant in the media today, in the news and such, and that's the topic of vaccinations in light of this recent measles outbreak that we're experiencing in the U.S. So I guess before we get into some of those more detailed issues, perhaps you could give us an overview of the importance of vaccines in general.
Sure, certainly. So vaccines, well, the concept of vaccines has been around for several hundred years. Actually, it actually started with smallpox, and there was a scientist who noticed that people who got cowpox, which was a cow illness that was not as severe, tended to not get smallpox or have better outcomes. And so that kind of started the whole idea of, well, if we give someone a taste of an illness or a version of an illness, can we protect people from getting severe outcomes related to a specific illness or prevent them from getting it even in general? So this is not a new concept. It's been around for several hundred years, but it's probably the number one advance in modern science, right up there with clean sanitation and improved nutrition for people. It ranks right up there with the most important changes of medicine of today's era.
So how exactly do vaccines work in the body to prevent you from getting the illness?
Well, vaccines can work a couple different ways. Most vaccines work on the concept of, we try to show your body either part of that infection or a mild version of that infection in hopes of teaching your body to recognize those bacteria or those viruses, so that when you come across those as you live your life, your body will fight off those infections before it leads to any sort of illness or adverse outcome because of those illnesses.
So developing antibodies and so on.
Correct. It helps you develop antibodies, which are your body's way of fighting off infection. And there's memory antibodies. Those antibodies can last, hopefully, your entire life and protect you lifelong from these infections.
Although you do hear some vaccines where you should probably get a booster later on.
Correct. Certain vaccines work better than others or help your body remember longer than others. There's certain vaccines, like measles vaccine, that we think that if we vaccinate you as a child, we know that most people have protective antibody levels well into adulthood. There are some other ones. Tetanus is the most common example probably, where it's recommended that every 10 years or so you should get a booster to try to refresh your antibody response.
And the reason why we develop these vaccines to begin with is because if you get the full-blown illness, it can be deadly or have serious consequences, correct?
Absolutely. In the, pre-vaccine era, pre-sanitation era, 1 in 5 children did not make it to adulthood. That's a kind of a shocking statistic. Imagine nowadays that 1 in 5 of the children that you see walking around isn't going to live to adulthood. I mean, we don't see that anymore, and that's in great part because of immunizations, along with some of those other kind of modern medical advances that we've made.
And not to mention the flu vaccine. A lot of people died from the flu and pneumonia, and now we have vaccines for those that have been around for decades.
Absolutely. They all, as we've developed more and more technologies and more science, we've tried to vaccinate against as many illnesses as we can develop vaccines against, because it reduces mortality rate and death rates amongst the
And of course,
population.
just to get the ball rolling on the principle of the fact that we have research to back this all up, that the benefits of the vaccine very much outweigh the risks.
Right. Right.
And the other concept I want you to explain for our viewers is the concept of herd immunity. What does that mean, herd, H-E-R-D, immunity?
So that's a very important concept when it comes to vaccines, in the sense that the more people we protect from getting an illness through vaccine, we actually not only protect that person, but we protect people in the community that have not gotten the vaccine or can't get the vaccine because of some medical illness that they have that prevents them from getting vaccine, or they may not be old enough to get vaccines yet. So protecting everyone in the community leads to this herd immunity effect, which means that even people who aren't immunized are in a sense protected because the illness becomes so uncommon in the population.
Well, thank you very much for that explanation.
Sure.
What I'd like to go into now is specifically what's going on in terms of measles in this country.
Yeah, so it's been very, if you've been watching the news over the past several weeks, I don't know that there's a way you can escape hearing about measles because it's so pervasive. But yes, in California along the West Coast, there's been a large number of measles cases. And this is a theme that we've been seeing going on for the past several years, where the number of measles cases has been kind of ticking up every year. If you look back to the year 2000, we actually eliminated measles in the United States. There was not a single case of measles reported in the United States that started from here. Now, there were cases of people that went to China or some other country and acquired measles and brought it back to the United States. And even recently, that's what happened. It's just that when that person brought it back to the United States, they brought it to an area with low vaccine rates for measles vaccine. Therefore, it started to propagate throughout the population, finding those people who were unimmunized and starting infection with them and letting them pass it on to other people. And even some people who got vaccinated got measles infection, but that's because not every vaccine works 100%. And that goes back to the herd immunity, is that another reason that we vaccinate everybody is that we know that 1 or maybe 2% of people who get vaccinated won't develop immunity from the vaccines. So those people are also benefited by the herd immunity effect.
But overall, vaccines are quite effective. You're just talking about a minuscule number of people that for some reason don't do well with
We're talking about a very tiny proportion of the population. Vaccines are highly effective. So indeed, yes, they cause immunity. About 99% of people who get the 2 doses of measles vaccine will have protective antibodies from measles.
And of course, we know measles is generally delivered, you get your first shot at 1 year of age. So kids in that 1 year, babies I should say, or young children, are susceptible in a sense because they're not old enough to get it. Why is it that measles, because it comes with the mumps and rubella shot as well, why is it the measles is such an issue?
Well, all those illnesses are important in their own right. We talk about measles a lot because it's the most infectious kind of organism known to man.
I did not know that.
Yeah, if you put 100 people in a gym room and one of those kids has measles, 90 of those other kids, if they've not been vaccinated, are going to get measles as well.
So it has the highest rate of infection.
Correct. It has
to
the highest
unvaccinated person.
It has the highest rate of infection to other unvaccinated people. That's why, in general in the United States, vaccine rates are good, but in the West Coast or in certain other pockets of the United States, we're seeing vaccine rates drop a little bit because of people abstaining for either religious or medical or personal belief reasons.
And we'll get to that, yeah.
And that's why we're seeing it pop up in those areas where vaccine rates are starting to drop, because they've lost that protective herd immunity effect.
And tell us specifically why measles can be so dangerous. I mean, I remember having measles as a child. I'm in that age group that I'm immune because I've had measles, and I remember it vividly. But obviously I survived, but it can be deadly, correct?
Absolutely. I mean, the fortunate thing is most people who get measles won't have a severe complication from it, but about 1 in 500 children that get measles will die because of that infection. And so
in today's world,
even with the medical care, and that doesn't include the thousands of other children that will be hospitalized with measles due to pneumonias or dehydration, or they may have permanent medical damage, hearing loss, or encephalopathy, other medical complications. So that
what's encephalopathy?
Well, it's kind of a change in your ability to think clearly.
So it affects the brain.
It can affect the brain, yes. Encephalitis or encephalopathy is a very common complication of measles, which can be lifelong and significant, even though it may not lead to deaths. But yes, it can certainly make you very, very sick.
So I guess the other statistic you mentioned when we were talking before the show is years ago, back before we had the vaccine, that 4 million people in the U.S. on average would have measles each year, and that 500 to 700 would die.
Absolutely.
500 to 700 would die. And these days, it's still a death rate of 1 in 500?
Yes. Before the vaccine rate, it was, millions of people would become infected, hundreds would die because, like I said, it's only 1 in 500, but when you have big numbers, it amounts to a large number of deaths.
And not to belabor this point too much, but some of our viewers may not be aware that you're saying in the early 2000s is when we started seeing the vaccine rates drop. And there's a good reason for this. It's all from a study done in 1998 that was published.
Right.
Very poor study, lots of problems, but somehow people heard about it and spread the word. And please enlighten us on what's happening.
Sure. So this kind of, I think as long as we've had medicines or had any therapy, we can sometimes clearly see the benefits, but we also need to think about the negative aspects. So in 1998, Dr. Andrew Wakefield, who's a British gastroenterology doctor, published a very small study of only 8 to 12 people that he said MMR caused autism in this group of people, and published in a very well-respected journal, The Lancet. It's probably the most respected journal in Britain. So it got a lot of media attention. Doctors started turning their heads because as doctors, when we see scientific evidence that counters our point, we start to change our thinking.
Even with such a small number?
Well, and we shouldn't with just such a small number, but it made us think about the question a little bit more. Okay. This said we need to study it on a bigger basis. So they did. They repeated that study with millions of people, and they can't replicate it. And when we started looking back, it actually ends up that a lot of this data was fabricated. There was a lot of issues of conflict of interest with Dr. Wakefield working as a medical expert for lawyers that were suing vaccine companies. He's actually lost his medical license. They've since retracted this medical paper because we know it was made up, essentially. And we have other much larger studies that refute that original study. And that's the important point is small study, can't trust it a whole lot. Big study, millions of people, been replicated several times, different countries, different populations. We know the answer to that question, and that is that vaccines do not cause autism.
Unfortunately, it took several years to accumulate all that evidence.
Right.
And sometimes it's hard to undo.
Right, and that's what we're seeing is, as a consequence of that bit of misinformation, people started changing behavior and vaccination rates started to decline. And now we're seeing a resurgence of all these illnesses that we've once eliminated effectively because of these vaccines. And I hope that people will see, these diseases, and it'll help remind them of the importance of these vaccines, that these diseases are real, and that if we don't depend on these vaccines, that we are going to see measles come back. People are going to start to know that kid who died because of some preventable illness. And I hope we can start bolstering vaccine rates again so we don't have to live to see that shortly.
That's right. You're saying a lot of young mothers today are not familiar with any of these illnesses.
Right. The mothers, or parents these days have grown up in an era where they have widespread vaccine rates, and they don't know the friend that got chickenpox and ended up in the hospital and with brain damage because of it. They don't know the child that got pneumococcal meningitis and died at 2 months of age. We just don't see that. In part, vaccines are being affected by their own success. They're so successful that people don't fear the illnesses anymore.
And of course, luckily, we're a little behind the 8 ball as we have the CDC and the American Academy of Pediatrics that's saying we have all these scientific evidence to show this, but unfortunately when that study came out, a lot of people got on that bandwagon, including some celebrities.
Right.
Jenny McCarthy's been implicated in the media as telling mothers, I have a child with autism, don't get your child vaccinated, there's a chance it could cause autism. And it kind of created a panic that wasn't based on accumulated scientific evidence, just one study of 8 people.
Right, exactly. I kind of relate this back to the flu vaccine thing too, or in general, people tend to think about things that happen around the same time as being causative, so we diagnose autism usually at 18 months to 3 years old, somewhere in that gap, and that's when they're kind of just finishing the series of getting lots of vaccinations, and so that's why people started to think one caused the other, but we now know that is well studied and not true. But there are going to be vocal people who are hesitant to accept the scientific facts. But we have to rely on science. That's how we got here. That's how we got here.
Science is good. And, then come to find out Jenny McCarthy's son ended up not even having autism. So it was just very bad. The whole thing is so unfortunate.
Yeah, and people, and people who are very against vaccines, they tend to be just kind of skeptical people who are very mistrusting of government or big society, big industries,
establishment, and so
on. So it's difficult to kind of get those people to trust in the industry.
You can't tell me what to do type attitude, with my child. But we know we're trying to protect not only the child, but it's a society in general. It's a public health issue.
And that's why it's so important, you're right, is that the decision to not vaccinate a child doesn't only affect that child. It affects the health of the community, which is why it's like you said, a big public health issue.
Let's talk a little bit about the exemption issue, because one of the things you mentioned is one of the reasons it seems to be out west is those states have a little bit looser laws in terms of when you can say, I want an exemption from getting this vaccine. And there's 3 types of exemptions: medical, philosophical, and religious.
Correct.
So briefly go over each of those.
So because we as a people feel the vaccine is so important, we make it a school entry requirement so that children who are going to be entering the public school system are required to be up to date on their vaccines. If they are not up to date on the vaccines, states allow people to exempt from vaccines for, like you said, one of 3 reasons: religious. I personally have a belief, or my religion doesn't believe in vaccines. And I think it's important to note that most major religions all have openly supported vaccines. So religious exemptions should be few and far between.
And has the Autism Society too.
Correct.
Autism Speaks.
Autism Speaks has come out in favor of vaccines. Mm-hmm. There's lots of parents of children that have autism that are in favor of vaccines because they've come to accept the science, of it. So religious exemptions is one exemption. Medical, there are certain medical conditions that prevent people from being vaccinated, related to usually being on chemotherapy or drugs that affect your immune system, or there's certain neurological conditions where you shouldn't get vaccinated, but those are very, very, very few. And then the last one is the personal belief exemption, just to say that I don't believe in science, or I don't believe in these vaccines, and that's the one that's, I would say, the most controversial of the exceptions, is that there's only a few states that allow personal belief exemptions, and those states have higher rates or lower rates of vaccines in their school children. So I think that partly getting rid of that personal belief exemption would help increase vaccine rates overall, help get that herd immunity back so that we can stop seeing these illnesses spread around.
Well, then couldn't someone just revert to the religious exemption, or are the states now trying to make it harder for those exemptions to exist?
They are. I mean, states certainly view the importance of having high vaccine rates, and there are certain states that are trying to make it more difficult to get exemptions in general, which I think is a good thing. And they're trying to make it more difficult by making sure those people are making educated decisions. So some of the states are making it so that you have to speak with a physician and have a conversation with a physician about vaccines before you can apply for a personal exemption or a religious exemption. And I think that'll help in a lot of cases, because I think a lot of people are making these decisions based upon poor information or something that they heard off the internet or something they heard off of Jenny McCarthy. And so if they would, if we would take the time and talk to these people, I think that we could educate them about the importance of vaccines. So I think it's a great idea to try to get rid of some of these exemptions.
Now, as a practicing pediatrician, what are some of the questions you're hearing, and then what do you say to mothers questioning this with regard to there are some risks to the vaccines. Now they're much outweighed by the benefits, but people do want to know exactly what the risks are.
Yeah, absolutely, and I encourage people to ask questions, because I think every parent is trying to make the best decision they can for their own child. I believe even the people who are choosing not to get vaccines are doing it not because they don't want to do the herd immunity, they don't care about your neighbor, but they're just trying to do the best for their own child, even though they may be using some misinformation for that. So I hear lots of questions about vaccines. Why so young? Why so many? Why so many at one time? I talk to these parents and I tell them that all these questions are the same questions that I as pediatricians or medical researchers ask. And we've studied these things actually. We vaccinate children so young because they're the ones who are most risk of having the worst outcomes. So, if you get whooping cough, for example, when you're 4 months old, you are much more likely to end up in the hospital or have death than a 20-year-old who gets whooping cough. So part of the importance of so many so young is they're the most vulnerable population. And I get asked about, ingredients in vaccines sometimes. So, if people spent more than 2 seconds on the internet, they've probably heard about either thimerosal and vaccines.
That's a mercury compound, and that's since been out of vaccines
right.
for some time.
Exactly, yeah. So even moving beyond just the number of vaccines, you get ingredients, and we've looked at those questions as well. Scientists answered those questions, that mercury is not in any vaccine except for multi-dose flu vials, but even at the doses at which it's used, it's safe. It's safe to do that.
It's a preservative, right, to prevent bacterial growth,
right.
And I don't think anybody would want that.
Exactly, right. We put the thimerosal in the multi-dose flu vaccine specifically to prevent bacterial infection of those vials. But yeah, we've tried to look at all these questions about vaccine safety, and with every aspect that we've looked at, it all at the end shows that there's no increased risk of adverse outcomes. There's no increased risk of autism or other mental disorders as a result of flu vaccines. Yes, you kind of mentioned, are there risks or the adverse side effects of vaccines? Well, of course, there's risks with every decision that we make. But the important thing to keep in mind is those risks are incredibly low and far outweighed by the benefits of vaccines to not only yourself but also to society. The common ones that I see are maybe a mild fever after vaccine, maybe feeling a little bit achy, some local pain, redness, or tenderness. But I would certainly trade all those things as opposed to getting tetanus or flu or any of these other vaccines.
Tylenol for that.
Right, exactly. And all those things are very short-lived. The risk of a rare or of a serious vaccine reaction is greater than 1 in a million. So incredibly low.
With that in mind, then, tell us what are the updated vaccination recommendations these days?
Sure. Well, it's getting complicated. It changes every year because every year we look at the vaccine schedule and we try to say, are we doing the best we can? Is this the optimal schedule? Like I mentioned earlier, we always are trying to create new vaccines to try to protect against more and different types of illnesses. In general, your child will get vaccines starting at 2 months of age with most of their vaccines, and they're going to get vaccines pretty regularly at all their visits up and through the age of about 15 months to 2. There are some more after that, but they're mostly boosters. Like I said, we're trying to front load your protection as much as we can, but today's vaccine schedules include things like measles, mumps, rubella, tetanus, diphtheria, bacteria that cause meningitis and pneumonias.
And hepatitis.
And hepatitis, yeah. I mean, I always tell people, I'm a third-generation pediatrician now.
Oh
my father was a pediatrician in this community for a long time. My grandfather before that in Puerto Rico. He's the oldest pediatrician in Puerto Rico, and it's important to talk to people with perspective. I talked to my father when he was still alive. My grandfather, every night they were admitting children that had tetanus. My dad was doing lumbar punctures on children to look at meningitis because 3 or 4 times a night he would admit a child with meningitis. Fortunately, I don't have to practice that way. I've never seen a child with tetanus before. I've seen meningitis, but it's far less frequent than it was. So these things are very important, and they work. So I'm thankful that I can practice and live in an era where I don't have to admit children with tetanus or meningitis.
Well, unfortunately, you still have to keep reinforcing the importance of vaccines,
absolutely.
More so than we had 2 years ago when they first came out, or we knew these are
right.
great way to protect the public and protect one's own health. So I'm so happy you could be on the show. Of course, your father was my boy's pediatrician. I thought so much of him, and I think it's just wonderful that you took over his practice.
Well, I think it's great to be back, in the community that I grew up in. A lot of the patients that I have are friends of mine that I went to school with. So it's nice to be in a community where, I can know all the patients and have that real community feel for it. So I'm thankful to be back.
Well, we're glad to have you here because I know that was quite a large void left when your father passed away so suddenly. I know we wanted to talk about websites where people can get more information, and I think there's the usual Center for Disease Control, or CDC, has a lot of information on all the vaccines and the schedules and so on. And then the American Academy of Pediatrics.
Yes.
Your father would always talk to me, and those, that's what they say, that's what we do.
Right.
So I imagine you subscribe to their position, which is pro-vaccine.
Oh, yes, absolutely. And I think that, that those are both excellent resources. I think another resource is that the Children's Hospital of Philadelphia has a vaccine information center. They have a whole dedicated website that talks about vaccines in general, but also talks about a lot of specific common questions that I get from parents. Timing, ingredients in vaccines, possible reactions, and it outlines all of those in this website. I think any of those websites would be great places for parents to go.
And that's called the CHOP Vaccine Center.
CHOP Vaccine Center.
They're very well regarded.
Absolutely, yeah. Children's Hospital of Philadelphia does some of the premier research in pediatric medicine in the United States, so highly respected. The person who puts that website together is Dr. Paul Offit, who is an infectious disease doctor who created some of the vaccines. So he's certainly an expert in the field.
Sure.
You may have seen him going around some of the media networks. He's frequently a guest there when they talk about vaccines. So it's a great place to get information.
Well, thank you so much for taking the time and for sharing your expertise on this very important topic, especially for our local community. And we'll post those websites at the end of the program.
Yeah, thank you very much for having me.
And thank you for joining us for this edition of Focus on Health here on PAC 14.